Hello everyone, today we are going to learn acute infection of superficial tissue in surgery. We are going to learn two diseases, one is called furuncle and the other is called carbuncle. Etiology and pathology is the acute bacterial purulent inflammation of a single hair follicle and its peripheral tissues. The difference between furuncle and carbuncle is that carbuncle is a purulent infection of multiple hair follicles and their surrounding tissues. The infection range of carbuncle is larger and the systemic reactions is more serious. There are three related factors of furuncle. The first is related to local skin uncleanness, abrasions, poor excretion of subcutaneous hair follicles and sebaceous glands, or reduction of body resistance. The second is related to areas rich in sebaceous glands such as neck, head, and back. Third, Staphylococcus aureus is the main pathogen because Staphylococcus aureus can produce plasma coagulus. The fibrinogen in the infected site can be transformed into fibrin, thus limiting the spread of bacteria, and inflammation is featured by limitation and pus impulse is formed. The clinical manifestations of furuncle are divided into three stages. In the initial stage, there is a small scleroma, diameters smaller than 2 cm, with redness, swelling, fever, and pain. After a few days, the range of swelling and the pain is enlarged. The central tissue of small scleroma is necrotic and softened, and yellow-white pus impulse appears, and fluctuation is sensed when touching. And then most of the pus impulse can fall off and break. After the pus is drained, the inflammation will gradually disappear and the affected site will heal. As for some furuncle, soft furuncle with no pus impulse, the inflammation will disappear after anti-inflammatory treatment. Facial furuncle, especially furuncles on nose, upper lip, and peripheral, so-called dangerous triangle, in particular due to improper treatment such as being squeezed, pathogens can enter the intracranial cavernous sinus along the angular vein and the ophthalmic vein and cause purulent cavernous sinus phlebitis. Progressive facial swelling occurs and it can cause shiver, high fever, headache, vomit, coma, even death. So the furuncle of dangerous triangle can't be squeezed at will, which is easy to cause intracranial infection. In addition, it is called furunculosis when several furuncles occur at different parts. Or furuncles occur repeatedly in a period of time. It is related to the patient's low anti-infection ability such as diabetes. Furuncles are different from carbuncle. Carbuncles are multiple adjacent furuncles. Furunculosis are multiple scattered furuncles. Diagnosis and differential diagnosis. It is easy to diagnose this disease. Blood routine examination is required in case of such systematic reaction as fever. Blood sugar and glycosuria should be examined for aged people or patients with furunculosis or pus bacteria culture and a drug sensitivity test should be performed. The lesions to be determined include sebaceous cyst, commonly known as steatoma infection, mild acne infection, carbuncle, etc. The diagnosis of sebaceous cyst affiliated with infection mainly depends on case history. When infection has not occurred, the skin on the surface of the cyst is normal. Only the bulge appears. Acute infection may occur, swelling, the pain. The acne lesion is small and its top has slight congealed fat. The carbuncle lesion has large range with several pus, emboli, and in addition to redness, swelling, and pain, there are still serious systematic systems. Prevention and treatment. Keep the skin clean. Avoid excessive sweat stains in summer or in hot environments. Take frequent showers and replace underwears in time. For babies, care should be taken to protect the skin from injury. Local treatment. Application of drugs. Local treatment. At the stage of redness and swelling, hot compress, ultra-short wave, infrared ray, and so on can be selected, or traditional Chinese medicine jinhuang powder, yulu powder, or ectomal ointment can be applied. When a pus spot appears on the furuncle tip or fluctuation is sensed, phenol or iodine tincture can be applied on the pus spot, or the pus embolus can be removed with a needle tip or knife tip, but squeezing is contraindicated. Application of drugs in case of systematic symptoms such as fever, headache, and general malaise, especially facial furuncle, conquered acute lymphanoditis or lymphangitis. Antibacterial drugs such as penicillin or sulfonamides, sulfametazole can be applied, or the TCM prescription of clearing heat and detoxification can be applied. Insulin or hypoglycemic drugs should be given to patients with diabetes. Carbuncle. Carbuncle is the acute bacterial purulent inflammation of multiple adjacent hair follicles and their peripheral tissues, and may also be formed by fusion of multiple furuncles. Furuncles are different from carbuncle. Furuncle is the acute bacterial purulent inflammation of a single hair follicle and its peripheral tissues. Carbuncle, the acute bacterial purulent inflammation of multiple adjacent hair follicles and their peripheral tissues. The etiology of carbuncle. Carbuncle skin uncleanness, abrasions, poor excretion of subcutaneous hair follicles and subacescent glands, or reduction of body resistance. Carbuncle is mostly caused by Staphylococcus aureus and Staphylococcus epidermidis. The lesion is commonly seen in parts with thick skin such as neck and back. Inflammation usually starts from the bottom of the hair follicle and spreads to the subcutaneous tissues with less resistance, and then spreads to the periphery along the superficial layer of deep fascia, which is introduced into the hair follicle group to form multiple pus heads. Clinical manifestations. At the initial stage, local small skin is swollen, hot and painful, dark red in color. Several protruded spots or pus spots may appear on the skin, but it is slightly painful only, and the main symptoms include fear of cold, fever, reduced appetite, and general malaise. Subsequently, the range of skin swelling in the local focus is enlarged, and the periphery shows infiltrative edema. Enlarged lymph nodes in the drainage area, local pain is aggravated. The central part can be necrotic and fall off. Break with pus drainage, the lesion continues to expand and worsens with severe systemic reactions, even septic shock. Spatial carbuncle. Lip carbuncle is forbidden to be squeezed or pricked to prevent infection from spreading, cause intracranial purulent cavernous sinus phlebitis. Diagnosis and differential diagnosis. It is not difficult to diagnose this disease. Attention to the whether the elderly patients suffer from diabetes. Treatment, local treatment. When there is only redness at the initial stage, 50% magnesium sulfate for wet compress. Lithamol ointment, jinhuang powder, and so on can be applied. The carbuncle should be incised in time for drainage when multiple pus spots appear. The surface in purple, brown, or pus drains after it breaks. The incision's line should exceed the edge skin of lesion, and tissues that have been purulent and have not yet been purulent but inactivated should be removed. And then the pus cavity should be filled with saline or Vaseline gauze and bandaged with a dry gauze bandage. Application of drugs after the wound is clean according to the situation. If suturing or skin grafting is needed for necrotizing skin with large scope, penicillin can be used, and generally supporting therapy for patients with diabetes should be applied to control hyperglycemia. When the acute inflammation of lip carbuncle is controlled, limited, and has formed obvious subcutaneous abscess without breaking, we can make a conservative incision and drain the pus in the center of the abscess. Prevention. Keep the skin clean and treat furunculosis in time to prevent the spread of infection. That's all for today. Thank you.